In the 6th month of merger, Lakelands gave to us 6 Sigma trainings. Excuse the pun on that one, but lots of training opportunities to invest in our teams, not only Lean Six Sigma, but training on how to work with our staff from a labor and leadership standpoint, how to address conflict and have crucial conversations that are needed. But we've done a lot to build capacity and we'll continue through next year. In the 7th month of merger, Lakelands gave to us 7 waves of IT migrations, probably way more than that actually, but now over 90% of our organization is on the same instance, and that's something really that we've been able to lead and do a great job of, and it's going to really make our workflows a lot more efficient. So with huge thanks to our IT times playing critical roles, bringing our teams together and being able to talk to each other on the same system. In the 8th month of merger, our Lakelands gave to us 8 waves of staff hirings and 8 finance quarterly reports. It feels like 2025 had 8 quarters, to be honest. But our HR, our finance teams, and our transformation team, our teams kind of helping with the business end of things, doing tons of work, and deeply grateful for all the hard work to make sure we have the team and capacity and money we need to get our work done. In the 9th month of merger, Lakelands gave to us 9 EPI dashboards merging, not quite all done yet, but getting there, and other planning functions, really helping to support our teams across the organization. In the 10th month of merger, Lakelands gave to us I think maybe 10,000 if we estimate clients and partners and businesses served by our health protection divisions and infectious diseases, environmental health, clinical services, the various diverse teams, all that we do. And in the 11th month of merger, Lakelands gave to us 11 schools, okay, more than 11, but 11 schools visited and community health programs planned, lots of health promotion and collaborative work with partners across the region to improve the health of residents we serve. And the last one, excuse the real rough math on this, but in the 12th month of merger, Lakelands gave to us 12 squared multiplied by 2 Lakelands Public Health staff.
Yeah.
About caring, because I wanted to finish just with a reflective note of how deeply appreciative I am for all the hard work that our staff have done through what's honestly been a very challenging year. This merger, certainly I have full conviction, was still the right thing to do and will improve services for the residents of all of our region. But it's a challenging journey that has taken a toll on our staff, and I wish them health and rest and well-being over the next couple of holiday weeks and into 2026, which I think looks a lot more optimistic as we move forward, do more, and continue to serve the residents of our region together. So there you go. Thanks, and hope that the board would join me in thanking especially our staff for everything that's happened.
To follow, but as the board chair, the 12 months has gone very, very fast. I didn't think so at the start. We had a lot of challenging things to manage in the first quarter of the year, but the support from this board and the coming together of this board was one of the most important things that we could have done to make this move forward. So I want to thank the board for all the support they've given me over the past year, and the board committee chairs doing a lot of the work in the background to get harmonization sorted out, a lot of things that the other health units haven't done yet. So that just shows the commitment of the members from the legacy boards that came forward to support all of those things to make them happen and to sort of create a situation, as Dr. Pickett says, moving into the next year, more of a smooth ride, things to do still, but certainly a lot of the difficult things, I think, certainly from the board's perspective, we've managed to get them completed. I want to thank the staff, 100%, particularly in the early days of comms staff. There was a lot of communications that had to happen, a lot of with the branding, but just communications out there to manage the messaging from the merger and all those sorts of things. One of the highlights for me was saying a few words at the All Staff Day about a month ago now. to sit there or to stand there and look over a crowd of 270 people, enjoying the day, listening to different speakers and having some fun and some information. You really got a good feeling for the size of the organization and the folks in the organization that want to work hard for public health. That was kind of the message I got talking to different people that day. So that was a fantastic opportunity to bring staff together. We've had a couple of opportunities to bring the board together and get to know each other a little bit better. And so I think that was important to the consolidation of the board that we have today. We are Lakelands today, I feel. The other folks I want to thank is the Ministry of Health staff. Certainly in the early months, I had a learning curve as well. They had a learning curve to me as well. But we got stuff done and we got a lot of help from them for that. And we did thank Dr. Moore and his staff several times that without their help, certainly in the early days of getting things going on January 2nd, it was really important that they stepped up and helped. And so I really appreciate that as well. So yeah, so I want to wish everybody a Merry Christmas and happiness and health in the new year. And looking forward to 2026 as a year of transition. A lot of hard work's been done to get us moving in that right direction. So again, thanks to the board for that. Sorry, Councillor Ryle, yeah, sorry.
Yeah, just I can't say anything more than what both Ron and Thomas have said. I mean, I was only the vice chair, but at the end of the day, my God, what a group of people to work with. I mean, when you start out kind of sort of not really agreeing on a whole lot other than we should do something, to the point where we are right now, it's been an unbelievable pleasure and challenge. I just have one real disappointment. And the only disappointment I can think of is I didn't hear Thomas sing the 12 days Christmas. I would have really enjoyed it. So thank you very much, guys. Merry Christmas.
Thanks for the kind words, Steve. Appreciate it.
It's not over.
All right, go ahead.
Yeah, I got two. First one's serious, the second one is not so serious, but the first one is back to the flu. Do we have a sense of the uptake on flu vaccination for school-aged children?
The short answer is no.
Okay.
We have no way to monitor
The
that.
reason I bring that up, my wife's a school teacher, this is very anecdotal, over 20 years experience, she's reporting 30% absenteeism rates at her school at the moment.
Yeah.
It's huge, it's just on fire there. Of course, she goes into this petri dish every day and comes home.
Yeah, comes home bringing it.
The second one is, I'm glad you brought up turkey. My stepson's offered to host Christmas this year, but instead of learning how to cook a turkey, he's barbecuing steak. So Dan's not getting his turkey fix. I'm open to any invitations and we'll take a chance on however you cook your turkey with, hopefully it's done to the proper temperature.
There you go.
Thank you for the warning there.
Thanks. Thanks.
And that's it. Yeah.
Yeah, Warren Clark.
Just to try to accommodate you, one of our municipalities, Asheville, Norwood,
yeah.
is having a free dinner. It's all Christmas Day. And entertainment 1 to 4, all volunteer. So I'm sure they will welcome you if you would like a trip.
Thank you.
Yeah,
That's my
okay.
first invitation. And that right there.
This morning at our meeting, so. All right, any other comments, questions? Again, I do thank you for the last year. It's been a whirlwind, but I think we've all done a great job getting us to where we are today. So I'm going to ask for a motion to receive Dr. Piggott's update for information. Mayor Logel and Mayor Hankivski. All those in favor? Thank you. That's carried. All right, we're going to move to reports. Number 7. It's the wastewater surveillance for 2026. Dr. Piggott's going to review that for us.
Yeah, so we have Carolyn Pigeot, who's an epidemiologist on our team online. And just as she's getting ready and going to share just a few verbal remarks, the reports in the package, I think important to underscore that there was a decision by one of the legacy health units around temporarily locally funding wastewater surveillance when the provincial program was completed. And actually, this is one of the great star shining examples, I think, of strengthening public health through the merger that we can turn to in 2025, is that there's a solution to offer this program across the full Lakelands geography. So for that, I'll turn it over to Carolyn.
Thanks, Thomas. Hopefully people can hear me.
You're perfect. Yeah.
Perfect.
Okay, great. Yeah, good evening, everyone. As Thomas said, my name is Carolyn. I'm an epidemiologist at Lakelands. In case you haven't had a chance to review the wastewater surveillance report in the agenda package, I'll just briefly summarize. The wastewater surveillance is an important public health tool that helps us detect increases in respiratory illnesses like COVID-19, influenza, and RSV, often before people start seeking testing or care. It's been used for decades and became especially valuable during the COVID-19 pandemic because viral fragments appear in the wastewater days before symptoms appear. As Thomas mentioned, provincial funding for Ontario's wastewater surveillance initiative ended in July 2024, and the current federal program only supports 4 municipalities in Ontario now. So as a result, local health units now need to decide whether and how to continue this work independently. And prior to the merger and continuing until the end of this year, Peterborough Public Health continued wastewater monitoring through a partnership with Trent University, while surveillance in other parts of Ontario ended when provincial funding stopped. So with the creation of Lakelands Public Health, there was a clear need to determine a feasible and cost-effective approach for the entire jurisdiction. We did some analysis, and the analysis of historical data shows that wastewater surveillance provides early warning of rising respiratory illness, particularly in urban centers. The data is most useful during late summer through early winter, when respiratory illness typically begins to increase. And based on the evidence, we're recommending we continue our partnership with Trent University and expand surveillance to 4 sampling sites across Lakelands Public Health. This would run for 16 weeks from mid-August to mid-December at an estimated annual cost of $32,000. This approach gives us timely, actionable information, improves our geographic coverage, and ensures that we are well positioned to respond quickly to future respiratory seasons or emerging public health threats. So maintaining our partnership with Trent University is really key. Over the past several years, Trent has provided all wastewater sampling and viral signal testing for COVID-19, influenza, and RSV in the Peterborough area. This collaboration has proven invaluable, offering both scientific expertise and cost-effective service delivery. Preserving this relationship ensures we are prepared for future opportunities. So whether it's expanding surveillance to other illnesses, for example, measles or TB, or responding rapidly to emerging threats. Should a novel pathogen arise, this established partnership enables Lakelands Public Health to act quickly and effectively across all jurisdictions. And I'll just finish by saying that Matthew Harnden from Trent University is also on the call today, and he's available as well to help answer any questions you may have about wastewater sampling and surveillance. And I just want to say thank you for your time this evening, and are there any questions?
Thank you for that report, Carolyn. I'll open the table for Councillor Richardson.
Thank you. Excuse me. Thank you, and through you, Chair. This is the curiosity part for me, is how do we ensure like rural and private wells are captured in the surveillance?
Yeah, that is a tricky point for sure. The findings from rural areas are not as reliable, as the data can be skewed depending on where samples are taken in relation to the population, and due also to many households in rural areas not being on the municipal wastewater system. But I'll maybe turn it over to Matt to maybe supplement that with some more information.
Yeah, we did some smaller towns before, like up to 2,000 people, and some smaller like Havelock, and they're a bit more variable, as one or two households closer to the septic system, the treatment plant could have an outsized effect, or Millbrook right across the road is a long-term care facility. So the Daisy data is a bit more noisy than a larger jurisdiction would be, and we're also not capturing all the septic system, as Carolyn pointed out. So
Part of the strategy, though, again, 4 sites, we have to confirm those, but getting from each of the large municipal geographies within the region will at least provide a bit more of a balanced geographical picture. So while we won't be able to fully capture rural areas, there may be communities sampled that are closer to where.
Yeah, sorry, just a
Yep.
supplementary on
Yep,
that note. So that is the one concern that we see, because obviously geographically, we are mostly rural.
Mhm.
Right? So, you're looking for that representation. Is there any emerging risks right now that they're seeing in any surveillance?
We're seeing, so like in the data,
Yes.
so you're certainly seeing some of the pattern of what we're seeing, and we're talking about across the country, but locally we get that data with COVID, and there's also sampling for RSV and influenza as well. So the local data is able to complement some of the other data sources, and provide information. So the idea, and again, we weren't bringing sort of more for a decision, but just more follow-up, because that program that was temporarily funded by the board of one of the legacy organizations was funded until the end of this year. There was a commitment to kind of bring it back to the Board of Health for awareness. So.
Warden Clark and then Councilor Chika. Yeah.
Thank you for this, through the chair. It's very important, because even though it isn't the rural and the individual one-offs, it gives us a sense what is happening in our larger centers, and we're in and out and commingling. So it's great data. My question around this is, why are there only 4 areas that are supported by the province? And how did they get to be one of the 4 and not us?
It's actually the federal government. So there's a federal government
Oh.
program through the Public Health Agency of Canada that stepped in when the provincial program finished. Those are Carolyn, help me, Toronto, Kingston, Windsor.
London and let's see.
I think London, Windsor, Toronto,
Peel.
Kingston, so Peel, so not Windsor. but,
Okay.
But
Yeah,
Ottawa, for example, isn't even involved.
Yeah.
There,
Yeah.
I mean, I think it was a combination of factors that they would have taken, but we are quite far from any of those sites, unfortunately.
Centers.
So
Okay,
this
thank you.
data is able to add and complement to that. And one of the pieces for me is this has been a wonderful academic partnership.
Yes.
That would be such a shame to lose in the context of future emerging infectious disease threats, being able to pivot and add, we have through this program in partnership added a couple other viruses as they were emerging to be able to see. And we know, for example, from work in the United States, we were able to detect polio, something should certainly be eliminated from the Americas through wastewater surveillance, and that can guide some other public health actions. So this keeps the door open to that future ability to add that if needed.
Yeah, and certainly very cost effective
Yeah.
partnership compared to private labs. We certainly wouldn't be able to afford this if it wasn't for Trent and the cooperation there that we've maintained with them. Councilor Chika, yeah.
Thank you, Chair Black. Through you, just wanted to say thank you to Carolyn for presenting the highlights of this report, and to Matt for all your work in analyzing a way to be able to increase the scope of this to our entire region. That's really terrific, and just thoughtful and generous. And I was just thinking, after we had our training, key strategy number 2, about being leaders in our merger consolidation, that we are leading the charge on this. And this is an example that we could showcase to larger boards of health about being proactive and constructive and building relationships with our academic research institutions. And it's a big thing. And we're seeing that numbers are up, and this is something that's relevant to so many communities. So thank you very much for extending this in a larger scale and in a broader scope. Thank you. Through you, Chair.
Thank you for the words, Councillor Chika. Yeah, certainly the relationship is huge, and you know the data that's going to come out of it. You know, we talked about providing the ministry with the positive aspects of the merger. This is one of them. These are one of the programs that we're going to be able to share that was started in Peterborough and shared to the whole Lakelands regional. Mayor Hankivski.
So it's related, but it's a bit of a tangent. I hope you can indulge me, but I've been thinking a lot about how some of the public health changes in the US are going to start impacting us here in Canada. So I'm wondering if the federal government has any plans to start monitoring closer to the border. And second, and this is a question for you, what can we be doing as a public health board to be thinking about, you know, the public health implications of the craziness of the US and the changes that are being made by previously legitimate health authorities there?
So, I mean, in terms of at a federal level, there's certainly been discussion about the need for ongoing surveillance. And so the federal government has continued wastewater surveillance in a few key locations, and a lot of those close to the border. Border traffic. In addition to, I think, strengthening other collaborations globally with countries that are continuing to be rooted in evidence-informed, science-based interventions and learning from that. I think as a local board, you know, there's core bread and butter public health work that we can continue to strengthen and do, and I think that's one of the most important things. So ensuring that the recommendations that we do for childhood routine immunizations is rooted in the scientific guidance from Canadian communities, strengthening our immunization support services for schools and enforcing the legislation that we do have, and ensuring that all of the meat and potato, bread and butter, whatever we want to call it, of public health is implemented well and strongly. I think further to that, we're certainly aware and are on various listservs of global public health intelligence. I don't know if intelligence is the right word, but networks that keep us informed related to infectious diseases globally, and what could be presented and how they might manifest.
Thanks, Dr. Moore.
Thank you. Any other questions for Carolyn? Well, again, Carolyn from the board, thank you very much for the work you do, and certainly Matthew as well from Trent. We really appreciate the relationship and the ongoing program that we're going to put together. I think looking forward to future reports.
Thanks to Dr. Kyle.
Yeah, and thanks to Dr. Kyle at Trent as well. Thank you. All right, so we need a motion to receive the report for information. Councillor Richardson, Warden Clark, all in favor? Thank you. I'm missing people online. I should be getting them.
I can watch for him for you. It's hard.
It's hard. Sometimes they're there, sometimes they're not. So
yeah.
All right, so we move to item 8, which is consent items. There are only a few items, letters and minutes from the Indigenous Health Advisory Circle for consent items. Anybody want anything pulled? See any hands online? Okay, so we have no, we'll move to a motion to pass all of the consent items as presented in the agenda.
So I see Dan. He's got his hand up.
Oh, Dan's got his hand up. Sorry, go ahead, Dan.
Anybody else on screen?
Yeah, is that the motion? Or?
Oh, that's the motion, Dan?
Just moving it.
Okay, moving it, okay, so we have Dan moving it,
Dr.
seconded.
Stelter.
Dr. Stelzer, yeah. Any further? All in favor?
It's hard to see.
Thank you, yeah. Counselor, you look like you got a sun lamp on him or something. He's trying to get a tan. He's going in tonight. All right, so,
There's some interference there.
all right, so, moving to item 9, which is new business. Is there any new business, of the board? Don't see any?
Nope.
No, oh, sorry, go ahead, yeah.
Just a really happy reporting that, the Youth Wellness Hub here in Port Hope headquartered, had its official opening last Friday.
Nice.
And we had a
Nice.
number of
Congratulations.
ministers here and, other dignitaries, and it's, been very well received by youth. And I'm now heading, 100 Hearts That Care campaign to try to raise money so that we can actually get it open on the weekends, because there's not quite enough money yet for the weekends, and that's a really important time, so, but we're off to a good start.
Perfect.
So, may I ask questions?
Yeah,
Yeah,
go
through the chair.
Amazing.
Website, where do people go to donate for this? A little more information for people that maybe.
Sure, I'd be happy to send around some information. It's a 3-year commitment, and we're bringing together individuals, businesses, or groups of businesses, or teams. So we have teams of moms, et cetera, but the commitment is for $2,400 a year for 3 years. There's tax receipts, but we found a good response. If people can't do it individually, they've come together and done teams of 10 people, and they're figuring out a way to do it. So the goal is about $250,000 a year for 3 years, so that the folks that are delivering the services can focus on that, and that people aren't ambulance chasing for money every 6 months or every year. It gives a little stability. It'll give an opportunity to hire a grant writer and a fundraiser to continue building on the work. And then the idea is to spread it out across different parts of Northumberland County, and then hopefully potentially into the Peterborough area, which desperately needs it. You know, it's sort of, the government decided that things ended up the GTA, and then the next one was in Kingston, and that's it, right? So we have a huge gap in this area.
Excellent.
To fill.
Great, thank you for bringing that up. Any other announcements under new business? No? All right, I don't believe there's any camera items that we've brought in forward. All right, so the date of the next meeting is January 21st, and it's going to be a fully virtual meeting. Technology working, of course. A little bit easier. We won't have we'll deal with the owl today. We probably had with the owl. Thanks, staff, Michelle and Alita, for getting us through and getting us going. Appreciate that. It's always stressful. I've never wanted to be the IT person. Never.
No.
Appreciate everything today and the extra stress ending your day today. So the meeting is at 4 p.m. and it will be all virtual. And unless there are any other announcements, I will ask for a motion to adjourn at what do we got? 5:53. 5:53. And we'll get some. So Dr. Makisha and Councilor Royale on the adjournment. All in favor? That's carried. Thanks, everyone. Have a great.